Medicine at Epicon 2015. I now invite Dr.R.M.Anjana, physical activity at MDRM. Her main research areas are prevention of diabetes, epidemiology, physical activity and translation into FACP and Masters of American College of Endocrinology. Dr. Anjana has received several awards including the prestigious Dr. Leela Krishnamurthy Award, Boringanul Junior Leadership Award. I request Dr. Anand
members from the press and media, ladies and gentlemen. You may all be wondering why we are here, and I think most of you know the answer. Today happens to be the World Health Day. So why is World Health Day important for diabetes this year? Because the World Health Organization, the WHO, in its wisdom for this year, and we as a WHO collaborating center were actually asked by WHO Geneva as well as the WHO regional office in Delhi to organize a series of events. In fact, this morning there was another event in Delhi where the minister participated, but since we were organizing this, I took permission to organize this meeting here. This is just recipe demonstrations and so on. And today's event that we're having now is a culmination of related to the rising trend of diabetes in this country. And unless we all come together, it's very difficult. And I don't know of any occasion, at least in this city, where people across representing different disciplines, right from the corporation to NGO, it's completely changed. But this is what the IDF in its wisdom has put forth. And China actually leads the pack with 109 million people. And I must add that the way that the Chinese study was done, the title of the paper in the Lancet is Worldwide Trends in Diabetes since 1980, a pooled analysis of 7 based studies which have been published. 751 studies have been published, and how many gone up more than double from 4.3% to 9%. Okay, now 4 and 9 may look small, but you're talking about the whole population here, and you're talking people are 20 years old and 22 years old. This new research has been done now. What protected these people from getting diabetes? Okay. Now what about women? From 5% in 1980 to 7.9% in 2014. Now this is very important. The number of adults with diabetes in the world increased from 108 million in 1980 to 422 million people in the year 2014. It's preventable. I think whatever we say should not get lost after this meeting is over. So we try to capture the essence of what we think will come out in this meeting, and of course we can always edit it with new inputs, things. So we brought out a small booklet. The booklet says diabetes is preventable, we all have to work together, emphasizing the need for multisectoral involvement, and I would request Dr. Muruganathan to kindly release this. Thank you. But we need one more from India office.
Concerned about prevention. Coming to the topic, the positivity, what Mohan said, should be spread to the physicians. He said first, in the last lecture, he said, can we prevent diabetes? Then he changed immediately. No, we cannot say can we. We said he can prevent the diagnosis. Prevent. So that is why we say, and the lifestyle modification, I got enough and more. Every time, everybody says lifestyle modification. So suppose somebody asks me, what is the best method to prevent diabetes? Lifestyle modification. 10 commandments I say. First commandment is lifestyle modification. Second commandment is lifestyle modification. Third commandment is lifestyle modification. But but we don't follow. We always say. So even when I came, one of the lifestyle modification, I myself and Prachi were waiting for lift. I told her, what we preach, we must practice. Let us climb the stairs. In my age, I said, I climbed, so she also climbed.
Thank you, Dr. Mohan. The Research Society of Diabetes in India is probably one of the largest organizations in India. I think the membership is crossed almost 10,000, and which has the widest contact with doctors throughout the country. But if you look at the annual meetings and conferences held by the association, most often the focus is only on secondary prevention and tertiary prevention. Spread the knowledge about diabetes, how it can be prevented. But the real work on prevention lies much more than the doctors. I think what the associations can do is spread the knowledge that diabetes can be prevented. That alone is a big message, because even now I feel many of the doctors are not still convinced that diabetes can be prevented. Most of, yes. they all think that diabetes is only a disease which can be treated, very little can be done to prevention. So one that associations can do is one is spread the knowledge that diabetes can be prevented. And
thank you, sir. Thank you for the opportunity given to the Indian Medical Association on the stage, where I think the face of the Indian country in the international is Dr. Mohan, and the academic work and the original work is done here. I think we have to appreciate Dr. Mohan for his forethinking on prevention. With obesity or a poor working condition and all these things. Today, diabetes is not alone in the city. We have seen umpteen number of patients from the rural population with nutritional status going in for diabetes. The entire community, the entire family, I have seen it all. I think taking the message into the society from the doctor's mouth as a family practitioner is much more easier to convince, and also to follow up the patient. Maybe a center like Dr. Mohan's will have to send an SMS, and a general practitioner down in the rural beyond Viluppuram can always call back the patient and get the information and screen the patient. And today we are talking about a 1-hour screening. You conduct a camp once in a year on November 14th. That's the only day we do a camp, and that camp is mostly filled by diabetics, not by non-diabetics. You have to ask the diabetics to bring at least 1 or 2 non-diabetic to screen them and educate our general practitioner, the IMA, that 1 hour sugar is much more important to detect the pre-diabetic status, so that we go forward and give the lifestyle modification to that.